morning, everyone. My name is Megan, and I just completed my Master's of Public Health in Epidemiology at the Atlanta School of Public Health. I'm currently working as a research assistant with Dr. Laura Rosella in the Population Health Analytics Lab at U of T. So you're going to be spending today with me, where I'm going to show you a day in the life of a graduate student attending a conference, and you're also going to be spending another day with me this week, where I'm going to head back to the Atlanta School of Public Health and show you some behind-the-scenes work that happens in our lab. And today I'm here in Ottawa, Ontario, where it's about 7:30 a.m. I'm here to attend the Canadian Society for Epidemiology and Biostatistics Research Conference. I'm here with some of my colleagues and even some of my classmates from my program who will be presenting. The work that we do in the Population Health Analytics Lab draws on extensive linked population-level databases, and we use this information to answer research questions relating to chronic disease prevention, health system performance, and we work very closely with population-level decision-making. Hi everyone, I've just arrived at the beautiful Carleton University and I'm about to head into the keynote talk. There are two speakers today, one from Europe and one from Canada, and they're both focusing their talks on access to data quality and measuring health system performance. So let's go have Hi everyone, I'm just on my way over to the building where I'm going to be delivering an oral presentation for about 12 minutes about the work that I did during my practicum placement in the second year of the MPH Epi program. And I'll be presenting on work that I did using linked population level administrative databases to look at what puts someone at an increased risk for homicide in Ontario. And I specifically look at what's the effect of being an immigrant or being a refugee to Ontario. A second objective of my analysis was also to look at healthcare use, so in the 1 year and 2 years prior to death, specifically for mental health and substance use visits.
I'm Megan. I'm a research assistant at the Atlanta School of Public Health with Laura Rosella. I completed my Master's of Public Health in Epidemiology, and today I'm going to be presenting to you some work from my practicum project. So we have males, rate ratio that's basically 4 times greater, so it's looking at those in the least deprived quintile compared to the most deprived. So those in the most deprived quintile were more than 4 times likely to die by homicide.
Good morning everyone, and welcome to day 2 of my Instagram takeover for the Atlanta School of Public Health. For those of you who are just joining us today, my name is Megan and I'm in the MPH Epidemiology program. On day 1 of my Instagram takeover, which was on Tuesday, I took you to the Canadian Society for Epidemiology and Biostatistics conference. Today I'm actually going to show you a more typical day in the life of a grad student, where I'm going to take you to my lab, which is at the Atlanta School of Public Health. It's called the Population Health Analytics Lab, and that's led by Dr. Laura Rosella. My day today kind of looks a bit like a couple meetings. So I have a teleconference meeting, an in-person meeting, and I'm also going to be analyzing some data at ICES. The other thing I'm going to be doing is finishing writing up a paper from my practicum. And so before I get to work, the way I usually start my day is by taking my dog for a walk. So that's what you're going to see next. Hello everyone, my name is Megan and I'm here with my supervisor, Dr. Laura Rosella, and I'm going to be asking her a couple questions about what I think prospective students might be interested in.
Hi everyone.
So the first question that I have is, what qualities do you think make a good graduate student?
Great question, a question that we get all the time. So here at Dalalana, we actually spend a lot of time looking for the best students. And obviously academics are an important part of our criteria, but I would say we really look for students that are interested in having an impact on population health. And there's lots of ways that people can do that. So I'm the PhD program director, so I can speak to that program in particular, epidemiology. And we, after we go through admissions and all the reference letters and grades, we actually interview all the candidates to make sure that they're a great fit. So what do we mean by having a great fit? So we really look for students that have evidence of leadership qualities or evidence in collaboration. We really want to make sure they're going to be good colleagues to their students as well as enrich the student life here at the school. We want to make sure that there's a good fit for their interests. So if they're really interested in studying a particular area, we want to make sure that there's research activity and good supervisors in that area for them. And we want to make sure they're really dedicated to improving public health, population health, and health systems. And so we get at a lot of that in our interviews, and I think it works well because we have amazing students here and a really good student experience, I would say.
I would agree. And what are some of the unique opportunities that you think Dalalana offers?
Yeah, good question. So in addition to our core programming, which we spend a lot of time making sure that they get a lot of good skills in whatever area they're focusing on. So specialize in addition to other areas, and these happen through collaborative specialization. So for example, I know Meghan, you're involved in the public health policy one. There's one in global health. There's many other collaborative specializations which are available on the website. So this gives students an additional specialization in a particular contact area, and they get to interact with students across the university in this discipline, which is a great experience. There's also emphases, so there's new ones emerging in data science and some other areas across the school, so you can add that on to the public health disciplines we already have in the school. So I think this is a great opportunity to enhance your degree even further and interact with students either outside your program or even across the university.
Yeah, exactly. And what kind of careers do you think are available to students who graduate from the MPH-EPI program?
So there are many career options, and so some people stay in research. They're either in a PhD or they go on to continue PhD studies. Some people will go off and work in the public health system or the health system at large. Some people work for not-for-profit organizations globally. So it's a really flexible degree because it's skill heavy. So you come out with lots of skills that are applicable to lots of areas. And then you're exposed to faculty that work in all those areas I just mentioned. So we have a lot of diversity in where our students end up, and we hear from our alumni often, and they're doing great things and having a big impact.
Excellent. Well, thank you so much for being here and for discussing this with me.
No problem. Enjoy your day.
Thank you.
See you soon, everyone.